From the lung cancer documentary, we learned about the different ways that they performed the surgery and how originally it was one large open incision that affected the person and caused a lot of post-op pain, and eventually it went down to 3 to 4 port incisions, down to 2 port incisions, and then a 1 port. And as the smaller ports were, even though it is more incisions, are smaller than the one large port was, or the one large incision was originally, and the 1 port approach is actually less pain for the affected post-op. Some different treatments, like I said, with surgery. There's also chemo and radiation, or there's a combination of different therapies. Lung cancer, if left untreated, leaves a person to have 7 months to live, typically, after their primary diagnosis. But if you treat the cancer, your expectancy goes up to 40%. While it's not a very high number, it's better than leaving the cancer untreated. Typically, lung cancer is diagnosed 90 days after your symptom development starts to your diagnosis. So you start realizing the symptoms, and then 90 days later, you're typically diagnosed. 80% of patients that have lung cancer usually have stage 3 or stage 4 when they finally have the symptoms presented. Lung cancer starts with an abnormal cell growth that is out of control. It can invade nearby tissues and form tumors, and these tumors can affect the respiratory system. There's many different causes of lung cancer, but being a smoker, being around secondhand smoking, asbestos, radon, and radioactive dust are some causes that trigger. Some symptoms are coughing, wheezing, shortness of breath, chest pain, and bloody mucus. And some ways to prevent it are stop smoking or avoid others that are smoking, and just take care of yourself, basically.